Thank you so much. It is such an honor to be with you all tonight, and I'm just so grateful that you are joining from all over. It sounds like a few countries, and we are going to dive right in. And by the end of this program, you are going to have a very, very good strategy and plan to truly supercharge your clear aligner program in your practice. And so, what are we going to talk about today? We are going to talk about why clear aligners and why now. I'm sure that you have noticed that our world has changed a lot in the last few years. And in fact, it continues to do that. It continues to evolve and change so quickly. And so I want to talk about why clear aligners are so important in today's world, in today's economy, and to today's consumer or patient. We're going to talk about building a clear aligner leader. I'm going to tell you my story of being a clear aligner leader and how I've trained hundreds of clear aligner leaders all over North America and why you want one in your practice. We're going to talk about the schedule for clear aligners, the financial presentation, and the consult. Usually, those are the three things that people need the most help on when they're getting started or when they're trying to ramp up the number of clear aligner patients that they need or want to see. We're going to talk about team buy-in because this is a team-driven sport, and this is something that is going to help you maximize your potential with clear aligners when you have a team supporting every single process along the way. I want to help you get more cases today. When you leave this webinar and you go into practice tomorrow, you are going to have the skills that you need to start more cases immediately. And I'm so excited to be able to help you with that because there is a mindset shift here that's going to really change the way that you look at clear aligners in your practice. And finally, I'm going to help you understand how clear aligners can help build a very powerful culture in your practice. It's one of the only systems or procedures in the office that touches every single team member. And when we can really maximize that, I have seen amazing things happen with the culture of practices as they get really good at systemizing their clear aligners. So my name is Allison. I am the founder of Clear Coaching and Clearly IG. I have been in dentistry since I was 17 years old, starting as a dental assistant, and I got into orthodontics pretty early on and fell in love with systems, with automation, with watching patients transform before my eyes as an orthodontic assistant. I then became a treatment coordinator and office manager at a practice in Bermuda, where I currently am right now, and learned that a lot of the success of a busy practice comes from change and from human behavior and from buy-in. And so I went to Boston for a year to go to school to become a certified professional coach and really dove into how we adopt new information and actually apply it into our practices. Because one of my favorite quotes is ideation without execution is nothing but delusion. And so as you're learning tonight and as you're thinking through this new information, every single step of the way, I want you to think about how you're going to apply it in your practice. I have created and built a systemization methodology for clear aligners that helps practices double the amount of clear aligners that they're doing in any given time. And it's been something that brings me so much joy because I get to see the way that it changes cultures and really helps support our patients. I'm a faculty for Align Technology, Upgrade Dental, and Dental Speakers Institute. And I want to share with you my story. So, as I mentioned to you, I was a dental assistant. I started working in ortho as an ortho assistant very quickly out of dental assisting school. And then I moved to the island of Bermuda. And I saw the potential in this practice. It was a legacy practice, 30 years old, very profitable, very productive. And the only time we did clear aligners is when a patient literally would pull on my doctor's sleeve or be like, Doc, I want clear aligners, I want Invisalign. And then we would start. And so, of course, as someone who fell in love with ortho, and I saw the potential. And so I started creating systems in the practice that ultimately, in a 10-year span, helped double our practice production. It wasn't just the clear aligners that got us to go from 2 to 4 million. It was the way that the patients bought into our comprehensive treatment planning. It was the way that my team became systemized through every single step of the way in the practice. And so when I think about implementing clear aligners in a GP practice, I get so excited because the potential is not just for profitability, but it's for taking better care of our patients, from creating a comprehensive, holistic approach to dentistry. It's about helping empower and engage our team in a different way, and also staying ahead of what dentistry really is today. I think you could probably agree and just type a Y in the chat if you notice this. But our patients are expecting more from us lately. They want more, they want it faster, they want it safer, and they have access to new knowledge that they didn't previously have through social media, through online education. They actually get to access different things. And so we need to stay ahead of that and we need to understand what our patients are looking for and then provide them with that holistic treatment in our practice. So I'm going to teach you how to do that today. So this is going to be interactive. So I want you to, you know, just be able to type in the chat about anything that comes up for you. If you agree, if you disagree, it's just going to help you stay engaged, stay focused, and really get the most out of this. Because I know you guys are here, probably your family with your families, maybe having dinner while watching this. And I want you to really get the most out of this webinar. So we're going to stay engaged. One of the ways that we're going to do that is you can go ahead and scan this QR code and access a workbook. Now, this workbook is absolutely built with all of my coach knowledge on implementation success. So you can go ahead and just scan that QR code, and it's going to give you this personal action plan that you can use, you know, typing while you're listening to start to implement some of the things that we're going to discuss tonight. So I'll give you guys a couple of seconds. Just go ahead and scan that QR code. And as we move forward, if you don't get it, I will make sure that we get it sent to you later on. So I'll give you a couple of seconds to grab that workbook. But as you can see in this workbook, specifically, it has who is going to be doing what, by when, and what the actual outcome is. So this will help you get very specific about your action items from this webinar. Okay, let's move into the opportunities of clear aligners. You're here tonight to learn about it, so I know you know the opportunities in your practice. But one of my favorite ones is that we want to stay future focused. We want to stay relevant. Again, our patients want more from us than ever before, and they have access to information they didn't previously have. And they see on social media, online, the opportunities to get clear aligners, not just in ortho practice, but also in a GP practice. And they know that it's more accessible to them than ever before. And so if we're not offering it, we're missing out on the opportunities to take great care of our patients in our own practice. And the truth is, our patients want to stay with us. They don't necessarily want to get referred to somewhere else. And so when we really look at your 5-year, 10-year, 15, 20-year plan as a clinician, clear aligners must be a part of that. So what are some of the benefits that we get to see when we do this really well? Clear aligners are what your patients want, even if they don't know it, but most of them actually do because of the direct-to-consumer marketing companies, because Invisalign does such a great job educating. Our patients want clear aligners. They know and understand the benefits of them even before we discuss them, but they might not know that you offer them in your practice. Comprehensive treatment planning. When we can move the teeth into the right position before we place anything permanent, we are going to take better care of our patients. And I know that we can sometimes have this assumption that if we're diagnosing or if we're treatment planning an implant or a crown or multiple crowns, that adding that Invisalign or that clear aligner cost can feel pretty heavy to the patient. And sometimes we can assume that they won't want to say yes to that because of the cost. But our job isn't to assume. Our job is to offer our patients the best option for care. And so it allows us to do that, especially in a GP practice, to be able to move the teeth into the right position before we place anything permanent, which will automatically allow us to keep more production in-house. And our patients want that. They want to stay with us because they already know you and like you and trust you. And so they would rather get that treatment done with you rather than move somewhere else to do it. It is a team-driven procedure. There is no other procedure in your practice that you can create systems to automate and delegate to your team that will allow you to multiply your production. We don't want to add more to your plate, docs. We don't want to give you more things to do, lengthen your schedule. But what we do want to do is have more production per hour. And being able to do clear aligners in your practice in a very systemized way that your team drives that bus will allow you to do that more than any other procedure in your practice. And there's this magical thing that happens when I was working in my practice in Bermuda for over a decade. I was the Invisalign coordinator, I was the office manager, I was the treatment coordinator. I ran 2 full-time ortho chairs, 2 days a week. I would run a full ortho chair. And I got to see a lot of transformation. I got to understand what patients wanted. And there was something that happened that was really beautiful after they decided to say yes to clear aligners. was that they decided to say yes to the rest of their oral health. And so that implant that they've been putting off for a long time, they would say yes to it. That those veneers or the cosmetic bonding after Invisalign, they would say yes to it because they had committed and started to see and understand the power of taking care of their oral health. So it turns into additional treatment presented on the path to overall health that your patients are going to be more likely saying yes to because again, you're giving them this beautiful experience that they actually enjoy. And so as a dental assistant, it really mattered to me that I got to see the transformation happen in the chair. I got to make friends with so many patients, and I was actually known on the island of Bermuda as being the Invisalign police. And so I would be out in public, and people would literally run away from me because they weren't wearing their aligners. And I got to really build this beautiful relationship with so many patients in the practice. And it was something that I love to be able to empower other dental assistants, other dental hygienists to be able to do just the same thing. So a big fear that a lot of my clinicians have right now is I don't want to put more on my team. I don't want to stress them out more. It's already hard enough to find a good dental assistant. But I want you to know that as a previous dental assistant, it was so exciting for me to be able to have the autonomy, to be able to build those relationships and be able to really run an entire procedure with my doctor. And then, of course, as an office manager, when I was hitting production goals, when we were setting our sights on doing better every single year, I loved to be able to see that our production would increase, that we'd be able to hit our goals. And my team became more confident and empowered because we were able to hit goals together. So I want you to just type in the chat or write it down somewhere. Why does this matter to you in your practice? I just shared with you why it matters to me, but you're here tonight learning about this and understanding how to do more, do better, systemize it even greater. Why does this matter to you to learn this procedure, to learn the system in your practice? And I would love for anyone to just type it into the chat. Um, Let us know, why does offering clear aligners, systemizing your clear aligners, training your team on clear aligners matter to you? And if you've not thought about that before, or if it's something that you're like, I'm not 100% sure yet, you're going to find out even more as we move along. Comprehensive treatment planning. Using orthodontics combined with restorative will give our patients a better result. And when we can diagnose the misalignment, the crowding, the malocclusion, we're here to keep our patients' teeth healthy for life. And offering clear aligners in our practice will help us do just that. So there was a transition that my practice went through where we were only offering clear aligners for cosmetic reasons. Patients would ask for them, we would do them. But when we shifted our lens and we literally put our ortho lens on for every single patient, that's when we really got serious about offering clear aligners in our practice. And that's when we really got serious about the comprehensive treatment planning with ortho first. And so my request to you is to think about this. And I'll talk about the systems that this relates to, but this helps us take better care of our patients, period. When we can look at the risks, the consequences, the issues that our patients are having, and they don't even know that there's an option for it. And the option actually is not difficult. They don't have to go into adult braces. They don't have to wear headgear. Aligners are something that's easy for people to wear, truly. And it allows them to prevent things from happening in the future. And so if there's any hygiene team members that are on this call tonight, this is something that I always say. It's like, once you see it, you can't unsee it. Once you see a large amount of your patient population go through clear aligners, and then you have these beautiful prophies where you have the teeth lined up beside each other, the bite is looking good, the recession is getting better. It's something that builds so much preventative dentistry for our patients rather than reacting. And so it takes that confidence in really knowing what to look for, why we're looking for it, and how do we address it and discuss it. So this is a statistic that I heard this a long time ago. And, I honestly thought that it was going to be reduced, but this statistic is still true to this day, that 74% of our patients that come into your practice have misaligned teeth, that have some form of malocclusion. And so the question that I want to ask you is, are you treating 74% of your patients with aligners, or are you referring them to an orthodontist? And Typically, the answer is no. And that's okay. But it's something that I want you to think about every single time you have a new patient come in, every single time you go and do a recall. 74% of our patients could benefit from orthodontics. And so it allows us to really understand how often we should be talking about this or how often we should be educating on this when it comes to the number of patients that could benefit from it. So my request to you is that we should be diagnosing orthodontic treatment 74% of the time, but look for it 100% of the time. And if you can wear those ortho goggles or ortho glasses every time you have a new patient exam, every time you're doing a recall exam, you're going to start doing more of it because you're going to start educating patients on the opportunity that they have to move their teeth into the right place. And so if right now in your new patient exam, you are not diagnosing, treatment planning, talking about their ortho status or their orthodontic treatment, now is the time. This is the sign to do it. So moving into the opportunities in your practice, from a patient perspective, from a practice perspective, we get to have this as a team-driven procedure. No other procedure in your practice is team-driven other than clear aligners. This is one of the most beautiful aspects of it. We're offering the procedures that the patients want. It's going to improve your culture and empower your team to have the skills. So from the practice perspective, the opportunities are huge. From the doctor's perspective, and we're going to talk a little bit more about this, you only need to do what you need to do. This takes some team training, definitely. This takes a lot of understanding of the processes and the systems, but the doctor only needs to do what the doctor needs to do, which will automatically increase production without increasing clinic time. It builds the cohesive team and improve patient experience. And then from the team's perspective, they get autonomy. They get to learn how to problem solve. It builds their confidence. We can build a really beautiful team goal and also helps them understand how to build relationships better with your patients. So let's talk about the systems. How do we create success immediately in our practice? The first thing is that everyone in the practice understands the goal. We have to know why we're doing what we're doing in our office. And this comes down to our practice philosophy and the why behind moving teeth into the right position before we place anything permanent. And then once they understand this is our goal, which comes from our doctors, you get to decide what your goal is. And you can start small and let your team know it's going to grow, but have a goal. If you're doing 3 aligner starts a month, try for 5. If you're doing 10, try for 15. But really set the goal so that everyone knows and understands what are we striving for? What does good look like? But have the team understand and have you understand and clarify what is the philosophy around this and why are we doing it? Why are we talking about this to our patients? Why is it important to us? Why is it important to us when we're doing a comprehensive treatment plan and we're diagnosing crowns and implants to put the teeth in the right place first? And then as we move into the buy-in from your team, they understand the goal, they understand the why, they know who is doing what, when, and how. Because really, this is a very different system than any system in your GP practice so far, because it allows for more automation, it allows to be faster, and it allows the doctor to not be involved as much. But what that takes for that success is that everyone knows who is doing what, when, and how. So if you are currently doing your clear liners and my docs that are here, they're thinking, oh my gosh, I'm doing every single part of this procedure. I'm in every single appointment. I'm doing all of it. I want you to know that it doesn't have to be that way. And in fact, the way to make it profitable and systemized is to not have it be that way. So the final thing is that your team is confident with their clinical and conversational skills, and they have time to learn it. So this is one of the things that I get asked all the time. How do I get my hygiene team to buy in? How do I get my hygiene team to talk about clear aligners? First things first, what is our goal in our practice? Do they understand the philosophy and the why? Do they know what their specific role is? And are they confident in talking about it? And usually when I dial in as a coach and I get deeper and deeper into the layers, especially for my hygiene team, it's because they don't feel confident and they don't want to look silly in front of their patient. And so this is the pathway to creating that success. But don't start with just pushing our teams to start scanning without understanding the goal, the why, who is responsible, and make sure they feel confident. So when I say your team is the driver, it's making that philosophy of orthodontics as a foundation for your patient's overall health. And I'm going to help you find some language to talk about this in a different way that your patients will really understand. And so if you have your action planner handy, or if you even just have a piece of paper, write down that you need to figure out what your philosophy is for clear aligners or for adopting more orthodontics in your practice so that you can share it with your team. And at your next team huddle, talk to them about it. This is why. This is why it's important for our practice. We want to help our patients keep their teeth healthy for life. And we can do that when we can get them out of malocclusion, out of misalignment, and put the teeth in the right place before we place anything permanent. So we help them understand that philosophy and then help them understand their own role and responsibilities that come from it. Because everyone has a role when it comes to clear aligners. Your front desk, your sterilization tech, your hygiene team, your dental assistants, they all have a role. So you must be intentional and repetitive about this. I get some of my doctors tell me, they're like, Allison, I told my team twice. And I say it takes 7 times for something to really sink in. And so if we haven't said it 7 times in different ways, then we still got to keep going. So be intentional and repetitive about building the team as a driver. So the systems that this relates to in your practice, your new patient exams. Are you screening for orthodontics at every single new patient exam? Are you taking a scan at every single new patient exam? If you were to do just that one thing, you would move the needle on your starts immediately because showing is believing, seeing is believing. So new patient exams, discussing your orthodontic treatment at every single new patient exam that you see can benefit from it. So it's 74% of our patients. Our hygiene visits. Yes, there is discussion on scanning at every single patient. A lot of practices do that, scanning it once a year, and being able to show the changes and being able to document the recession, the malocclusion, any shifting that's happening. But there's a place that you can start that's going to feel right for your practice, and then you can grow into it. So your hygiene visits, getting your hygiene team to really buy in to looking at the way the teeth are fitting together. And then, of course, all restorative and treatment planning appointments. And so I want to tell you a story that really was probably one of the most difficult moments of my career as a dental assistant, as my Invisaleader, as an Invisaleader, and as an office manager. And we had a patient come into our practice. He was 21 years old, and he was kind of like a party guy. He wasn't really good at making his appointments. He didn't make them on time sometimes. We all kind of knew the type of patient that is. And he did a backflip and broke his front teeth. And so when he came into the practice at an emergency appointment, my doc and I looked at him. We're like, yep, he needs an implant. Tooth is gone. He's going to need an implant. And so we did just that. We placed the implant. It looked amazing. He was happy, high fives all around. The team was celebrating. 3 years later, he's now working in insurance and he has a completely different perspective on his own health, his own life, his financials. And he comes to me, he says, Allison, I'm so excited. Now I can finally afford Invisalign. I want to get started with Invisalign. And my doctor and I, we looked at each other and just had this sinking feeling in our stomach because we knew that we had placed an anterior implant right on his central incisor. We had placed an implant. And we could still do clear aligners for sure. We could still do it. But if we knew that he wanted it, or if we offered it to him, we could have done a better job. And so from that moment forward, I had this realization that it's not our job to assume that a patient isn't going to pay for it, isn't going to value it, and isn't going to decide that that's something important to them. At the very least, we have to offer it to them. We have to educate them on what are their best options for care long term. And so this whole scenario drove me into solving this forever. And I did this one thing on every single restorative case that we were signing off on a treatment plan for. Anytime we were placing anything permanent in a patient's mouth, I would have them sign a treatment form that would say, I understand that I've been given the option to move my teeth into the right place before placing this implant, this crown, and I have decided not to. Something along that language. And what it would cause us to do in those treatment acceptance appointments where I'm presenting the treatment, we're discussing what's happening, is a pause where the patient would look at this and say, sorry, what does this mean? I'm like, right. So we have the option to actually move your teeth into the right position, remove that lower anterior crowding, open up your bite, and then place that implant so that we know that you're in a really stable functional bite before we place anything that we can't move later. And a lot of my treatment planning and restorative consults would turn into Invisalign consults. And some of them would say no. Some of them were like, nope, just want the implant, treat me with one single tooth. And we would do that. But we wanted to make sure that every single one of our patients was educated on their option. I never want that to happen to you as a practice where somebody decides later on after you've done something beautiful and perfect, but we can't move the teeth after that. And I don't want that to happen to you. So really consider in your restorative and treatment planning having that ortho lens on. And one of the things that I tell all of my teams that maybe are ramping up, maybe you're new to clear aligners and you're like, well, I haven't been offering this to my patients so far. There's three words. We now know. We now know that if we put your teeth into the right position before we place this implant, you're going to have a better result over time. We now know that we can actually prevent future wear, chipping, abractions, damage by putting your teeth into a position where you're not damaging them just by the way your teeth are meeting together. We now know that I can actually provide this in our practice with the training that I've taken so that you can have this care right here in our office. So don't be afraid to start talking about this if you haven't before. No matter where you are on this journey, now is the time to start this education system. So having this be a team-driven procedure allows you to set the systems and then be able to have it automated by your team. And yes, again, this takes some training, but it's not difficult for them. They have the skills, the capabilities, and the ability, and they truly are excited. I work with hundreds of team members when it comes to training on clear aligners. It's one of the most exciting things for them, but it also multiplies the doctor's time. So how do we make this successful? We must clarify each step and appointment and create systems. If you want to accomplish something once, you set a goal. If you want to accomplish something again and again with ease, we build a system. We want everyone to say and do things the exact same way because, again, that builds that trust, that builds that connection with the patient. If our hygienist is telling them, hey, I'm noticing your lower anterior crowding is getting worse, like I'm just seeing it's continuing to shift, or hey, I'm noticing that recession is getting worse. And then doc comes in and says, hey, I'm also noticing this. It just builds those layers of trust for the patient to understand that you guys are all on the same team helping support their overall well-being. And so we want everyone to say the exact same thing every single time. Now, we also want there to be a goal to work towards and everyone understands how to win. So this is where I developed a position in a practice called your clear aligner leader. I lived in this position for over a decade in my general practice, and it really allowed me to be accountable to watching this specific system. Because in a general practice, we have a lot to think about. We're thinking about perio, we're thinking about implants, we're thinking about oral surgery, we're thinking about general restorative work. Who in the office is always going to be thinking about clear aligners and keeping it top of mind for the patient? And doc, it's not you. It is not you. So there's a difference between accountability and responsibility, where the entire team is responsible for the skills necessary for clear aligners, but one person is accountable to them. This could be your office manager. This could be your treatment coordinator, but they're consistent in tracking your success, maintaining that goal focus, learning the newest and latest clear aligner information, planning the lunch and learns, talking to your rep, training the new team members, developing the protocols, and implementing the marketing strategies. So this is a person in your practice that is excited about these things, but somebody that you can train to be the one that's accountable to keep the team on track. So if you want to, you can have this as a dental assistant or a hygienist, able to bond and debond, have ortho experience, great at scanning and impressions, hopefully scanning, no more impressions, is personable and a good communicator, maybe has treatment coordinator knowledge, self-moted, tech savvy. These are the ideal skills for this person. But I want you to know that there's only two necessary skills, just two. They have a growth mindset and they have a great attitude because I have trained so many team members who don't have any of those things to be amazing Invisalign leaders in your practice. And so think about it right now. Who could be the person that is accountable to keeping you on track, goal focused, goal oriented, to be able to take this to the next level in your practice? And I always get this from some of my docs. They're like, Allison, this could be a lot of training for them. And what if I invest in their training and education and they leave? And my answer is, what if you don't and they stay? and you're running the clear aligner systems on your own, you're doing it all by yourself, and it's not as profitable when you do it that way. It's a lot more stressful, and truly, it does not need to be on your shoulders. So, a tip that I have for all practices, whenever I work with them or whenever you are learning something in your practice, is to automate and document as much as possible. So, if you're building your clear aligner later, also build the training systems, the documents, the contracts, film what you're learning or what you're training with an iPhone in your practice so that you can have an evergreen training system in your practice for those that come after. So just also keep that in mind. Anytime someone's being trained, can you film it? Can you record it? So that you don't have to do it again and again. Because yes, we are going to have a team turnover. We are going to have things change. But how do we make it so easy for a patient or for a team member to get onboarded in your practice with this high level clear aligner systems and skills? So what is the team's role? And what is the doctor's role? So my docs that are on the call, I want you to know that you need to come in for the consult. You need to be able to diagnose. You need to do the clin check or the treatment planning. You're going to be the one that's comprehensively treatment planning, diagnosing, and potentially doing the debond. Some of my teams actually do the debond, but you have to be the one to decide that it is a debond. The rest is up to your team. They get to do the scanning, they can do the bonding, they can do the financial, they must do the financial conversations. Do not do that on your own. They can even do your first step of your clin check planning. They are the one that's building that relationship, and there, as the patient advocate, they're helping with that comprehensive treatment planning diagnosis. They're educating your patient on every single step of the way, holding their hand throughout, and they are the ones that could potentially debond, depending on your state regulations and province regulations. But you obviously have to be the one to finally sign off on it. So know your role. This is what it gets to be. And again, this is what offers a lot of the practices that I work with: freedom, time freedom, the ability to have a lot of happy patients come into the practice without this being all on your shoulders. So what does that schedule look like? One of the first things that I do when I look at a schedule is I see where my docs are booking their Invisalign appointments or their clear aligner appointments. So you want this to be run, a whole chair run by an assistant. So if you are having a lot of aligner checks or the bonds in your clinical chair, get them out. Find a way to not be the one to be bonding. Find a way to not be the one to be doing the aligner checks. So the critical skill here for your assistants or your hygienist that is doing the aligner checks is that they know when to ask for help and they know when something's not right. But docs, this is for you to just hop into the room, say, hey, give them a high five, encourage them, maybe reinforce what your assistant has said to them, but walk out and let your assistant handle the rest. If you have IPR, definitely put that into your schedule. The last thing you want to do is be racing and rushing with IPR, but the rest gets to be in a separate ortho chair. So the way that you can start doing this is pick just 2 days a week, Tuesday morning, Friday afternoon, whatever one you can actually block off a chair for them if you don't have an extra chair. But definitely don't allow the patients to book anywhere in your schedule as you're starting to do more and more aligners, because you'll notice that there's a lot more aligner appointments than you would think when you get started, and you do not want to take that up your critical production time. So definitely start to think ahead. Okay, if we were to double our Invisalign cases or double our clear aligner cases, where do we put them? Who's doing them? How is this not going to be in my chair? And absolutely do not have your aligner checks and your debonds and your bonds in the doctor chair. So my question for you is, what are you going to need to change about your schedule? And I always say, prepare for the ramp up. Prepare sooner than you need to for the ramp up, because after this webinar, you may go back into your practice and say, guys, we're putting our ortho lenses on and we're going to be diagnosing, treatment planning, clear aligners, every single patient if we see that it could be helpful for them, which will result in a lot more case starts. Where are you going to put them? Who's going to see them? And start planning this ahead of time. Plan for that growth. When we can really focus on that growth and plan for it, it will happen. And so what are you going to need to change about your schedule in order to accommodate for this? Let's talk about the financials. This is something that I see all the time when I'm visiting practices, where a practice feels very nervous to talk about this. And so if you are, don't feel bad, but here are some really important tips and strategies that will help you be better at this. So all of the team members in the office should know the cost of your clear aligners and say it without hesitation. No, they do not need to be your dental assistant, your sterilization tech does not need to be presenting the financials to them. But if a patient asks and your team cringes or they are hush hush about it, it makes it an uncomfortable conversation for your patient. It makes them assume that it's very expensive. So all team members know the cost. If you have a range, fine. But everyone in practice needs to know and feel confident with that information. Your office manager or financial coordinator can sign off on all treatment presentations, but everyone knows and understands the cost. Do not make this hush hush. And this is something that's really, really critical. And I see the dial turn and practices start to do more aligner cases when the entire team and the doctor believe in the investment for the patient. And this happens often when I see practices start to do more and more, and they start to see the results, they start to see the patient's enthusiasm. You must believe in this investment. Your patients can tell if you don't. And so state it clearly, state it confidently. This is an investment in your patient's overall health and well-being for the rest of their life. So make sure that your entire team believes in it. Now, when I ask my teams, how do you present your financials? The worst answer that I could have is it depends. We want to have three, no more payment options. A pay in full with a potential discount, a down payment and equal payments over the course of treatment with in-house financing, or a third-party financing company like CareCredit. We want to be very clear about the options that our patients have. We want it to be so simple because when our patients are confused, they will not buy. And so with the economy that we're seeing this year and the data that we're running, a lot of our patients, especially our millennial patients, are really interested in that subscription model. They don't want to put a lot of cash up front. They really want to be able to pay for things over time in an automated way. And that's where these financing companies can really take the weight off of your practice and offer your patients the ability to pay for in a way that works for them and works for your practice. So have that as an option, but also have the option they don't have to pay interest. They can be financed in your practice, but make sure it makes sense to your office and there's clear guidelines and boundaries around that. And one of the things that I love to offer my patients is just to say, a lot of our patients love to put this on a credit card, get the points, and plus save money. So we can go ahead and take that payment in full today. So have only three options. Make sure that they're clear. Don't overcomplicate it because our confused buyers do not buy. If you have a patient walking out of the office confused, they are not buying today. So the reasons your patients are saying no, I think the most important thing is that you know why they say no. If you have a patient walk out of the office without saying yes that day, you must know why. But the three reasons that patients say no, it's not just about the money. They don't trust you. They don't trust the procedure. They don't trust something about the practice. They don't value it. And they don't have an option for them that works within their budget. But we want to build that trust and build the value even before we present the finances. So just know that if we do a great job, that patient trusts us, they know us, they like us, which is probably 99% of the patients that are in your practice today. If they can value and understand the benefits to them for starting clear aligners or the consequences of not, they will value it. And then if you offer them a financial plan that actually works for them and their budget, they will say yes. So how do we build that trust and value? Again, our consults and our, presence starts way before they walk in the door in today's world. It starts online. It starts in our social media. It's helping them know you, like you, trust you on social media prior to your first interaction. Because psychology is very interesting when it comes to familiarity. Familiarity is one of the 5 reasons why someone would fall in love. And so when a patient is familiar with you, no, we don't want them to fall in love with you, maybe your practice, but when they're familiar with you, they're likely to trust you more. And the ways that they can become familiar is to see the way that you speak, your facial expression, hear your voice online or on your website before they come in. The second thing for trust is relationship before task, always. You build that relationship before you talk about the teeth. And I think that goes with anything that we're presenting, anything that we're doing within our practice, relationship before task. When it comes to the value, know your patient's financial options before their visit. Check their insurance even before they come in the door. What will the future look like if they do something? What are they going to get excited about? What are the risks? What are the consequences if they do nothing? Tell them these things. Help them understand what their future looks like if they choose this or if they choose this. And it's not about scripting, but it's about a process. It's understanding how to talk to your patient, why, and how to get them to understand and buy in. So when we create that team of high performers, your team might not be excited about this. Truly, they might not be. And I see this a lot when I go into practices, is they don't understand why we're doing it. They might feel pressure without understanding the benefits to them or the patient. They have that lack of confidence, like we discussed earlier. They feel like they don't have time. They might not be confident in the doctor's abilities or unsure of what cases to bring up. So this is critical to talk about. These are the cases that we treat in our office. These are the cases that we refer. We talk about both. We don't not talk about it because we don't want to treat it. We talk about both. And then, of course, they don't know how to bring it up. So get that buy-in from your team, help them understand the benefits to the patients, the practice, and to them as professionals. Set that goal, make it fun and rewarding, make it part of your office culture, help them become aligner experts, and they will become successful at this. So this is my team in Bermuda. We would set team goals all the time. We would make sure everyone knows how to hit them. We would celebrate the small steps, and we would talk about our goal every single day. And there's two magical words that if I said this to my team, I would see more of what they're doing. So we think all the time, like as managers, as business owners, we have to not criticize our team, but like correct them. If they're doing something wrong, we must correct them. But if we see something great happen and we notice it and we pay attention to it, we will see more of it. So there's two words that I read this study in a Harvard Business Review 8 years ago. And when I started implementing this, it changed my team. When you go back in and you talk to your team about this goal, about what we're going to be doing, and you see them do it, you see them even do a part of it, you say two words. Yes, this. Yes, this is exactly what I was talking about, Sandra, when it comes to talking to our patients about Invisalign. Yes, this is exactly what I was talking about when it comes to tracking our success. When you notice your team doing something well, pay attention to it, tell them. You will see more of it. So set that team goal. It involves everyone in the practice. Start small and let your team know it'll grow. So how do we walk out of this webinar and go into the practice tomorrow and start more clear aligner cases today? We consider, what do our patients really care about when they come into our office and sit down in the chair? Again, you are here tonight to learn something for yourself. You're here to learn and to grow because you care about something. Otherwise, you wouldn't be here spending your time and your energy engaged in this webinar. What are your patients sitting in your chair for? Why are they there? What do they care about? What do they want? What do they need? What are they afraid of? When we understand what our patients really care about, that's when we can have amazing consults. So 6 steps to a powerful consult: understand your patient's why. I would tell my team, if you don't understand that golden nugget of information, don't move forward. Spend the time to understand your patient's why, and then present the treatment to that goal. For example, patient comes in and they say, I'm nervous that my teeth are going to shift more. I see my mom's teeth are very crowded. I'm very nervous about, having my teeth look like that in the future. I'm noticing they're getting more. So when you present to that goal. We're going to be doing clear aligners so that you don't have to have a future where your teeth are overly crowded like you're afraid of. So everything that they say, use those words and present to their why. If you don't understand their why, you won't hit the mark on that presentation. The third thing is use the PCS model. The PCS model is the problem, the consequence, and the solution. Because in your GP practice, you will have patients that will come in and they won't know what they want, or they won't know that they could benefit from clear aligners. So that's when our hygiene team and our doctors will say things like, the problem that I'm seeing is that you have really strong malocclusion. You're hitting really hard on your front teeth, and our front teeth are not meant to hit that hard. So that's the problem. The consequence of that is, you can see it on the scan. You've been wearing those anteriors very aggressively. You're only 25 years old, and I'm seeing you shortening those teeth. The solution, we move the teeth into the right place. We get the pressure off of your front teeth so that they're hitting more on the back than on the front. We protect your teeth for life. Problem, consequence, solution. Number 4, keep it simple. Do not over-explain it. When I'm listening to consults and I have a doctor say, we're going to rotate that lateral by 45 degrees and then distalize it and intrude it. No, keep it simple. Our patients do not need to hear that. And if they do, they will ask. We will have some engineers in our practice. They will want to know some of this stuff, but do not over-explain it. don't talk your patient out of it. I've heard some practices go into it's really hard to wear and it can be really annoying or uncomfortable. You don't need to say these things because for a lot of patients it's very easy to wear. They are very compliant. So don't talk your patients out of it when they're excited. And then finally, always make time to start today. Always make time to start today. If your patient is excited about it, if you are talking about it and they are engaged, start today. When your patient is sitting in that practice with you, that is the most they're ever going to be bought into this. Because when they walk out of their practice, they're not just competing with other general dentists or orthodontists. They're competing with Taylor Swift tickets. They're competing with, a Louis Vuitton bag. And they are, there's more out there when they leave your practice that they'll start to think about and consider. So always make time to start today. When they're bought in, when they're excited, let them start today. And if a patient calls and wants a consult, book them in as soon as possible. The answer for a patient to call and say they want an aligner consult or an Invisalign consult is what time today or tomorrow? Not next week, not 2 weeks from now. Get them in ASAP. So when we simplify that explanation for our patients, and this is something that I love to teach my hygiene teams, is the 3 ways patients lose teeth. 3 ways: their gum health, their tooth health, and the way their teeth fit together. So in your new patient exam, this is what you're going to be discussing. We're going to look at your gums, we're going to look at your teeth, and we're going to look at the way that your teeth meet. Make sure that you have a healthy bite and occlusion for life, because that's our job, is to help you understand the risks and the consequences of where your teeth are today and how we can make sure that you have healthy teeth for life. So with that new patient workflow, you take the scan and record, you educate the patient on the findings, your team can do this, diagnosis and treatment planning, and then the presentation from the team. So help them understand these are the 3 things that we're looking for. One of the ways you might not have heard before is we're going to look at your function and your bite. You can actually wear away your teeth in your regular function and bite, and we want to prevent that from happening. And some of the statements that I love to say, so we can keep your teeth healthy for life. We want to be in the business of preventative dentistry, not reactive dentistry. We don't want to fix problems in the future for you. That's why we're talking about this today. And again, if you have a practice that you haven't brought this up before, we now know that if we put the teeth in the right place, and if we open that airway, if you have done airway training, if you move those teeth to be beside each other, we can keep your teeth healthier for longer. We have to let you know what your options are. So really get into that education of what the options are for your patient. Because my patient that came in, an executive from Toronto, moved to Bermuda, and he had been going to the dentist his entire life. And he's like, I'm healthy. I'm super healthy. I, go to my regular hygiene visit. He says I'm doing great, but we should not be watching this. What are we waiting for? For these teeth to completely disappear? And unfortunately, a lot of the clinicians that I talk to, they're just afraid to talk about this, or maybe they don't know how to treat it on their own, and that's okay, but we have to start educating them. And so if this is not a case that you would want to take on, or if this is not a case that you would feel comfortable treating now, the more cases you do, the more education you get on how to treat these cases, it is so possible with aligners. And there's so many education systems out there that you can learn how to open up a deep bite, how to expand an arch. Like there's so many ways that you can do this. And so our first step is to start seeing it, start understanding it, understand the systems in our practice, and help our patients understand that we're here to take care of their teeth for life. And this is one of the 3 ways that we do it. So save your words and scan instead. A lot of my hygiene teams are like, I don't have time to scan. I don't have time to do another thing in the practice. But the reality is, when we scan, we don't have to talk as much because our patients are talking. Our patients are connecting in different ways than they will if we're just trying to explain the occlusion. We're trying to explain the misalignment. We're trying to explain the recession. They will not understand it as much unless they see it. So make the time to scan, because not just your clear aligner cases will be increased and case acceptance will go up. Other treatments will have better case acceptance because patients can actually see and understand. So change the way that you're communicating with patients. So when we talk about building or bringing in more cases using social media, marketing for clear aligners is one of the best ways that we can do this. A lot of our patients are looking at social media, using the face filters, understanding what's possible for them. And our patients want to have that beautiful, bright, healthy teeth. They want that now. It's normal for them. And so when you show them that you offer this, when you can explain to them that this is something that you do online before they even come in, it helps you just automate that process a little bit more so they are familiar with their options before they come into your practice. And we know that we have 57% of our population using social media 2.5 hours per day on average. That means that we have our patients 15% of their waking lives using social media. So we want to use that for our practice to tell people that we are offering clear aligners. We do that in our practice because it will stop you from having those patients come into your office. And I know this has probably happened to at least a few of you where they've come in wearing braces or wearing aligners from the practice next door or from the practice down the street. Let your patients know you offer this. So make it a part of your culture and have your patients get to know you, like you, and trust you even before they meet you. This starts the sales process. This helps them be familiar. It'll show them behind the scenes footage that they love. And before and afters with clear aligners are amazing. You can never take a before photo again. So start taking these before photos, start sharing some of your results because it's an interesting thing to think about with patients. They often look at the result like, wow, that's so beautiful. But the thing that captivates them the most is seeing the befores and resonating with that before and saying, oh, wow, that's what my teeth look like. I didn't know this was possible for me. So make sure that they know what's possible. So I want to wrap up in just a minute by asking you really, when it comes to your practice, when we're looking long term, 5 years, 10 years, 15 years from now, what is your measure of success? And the beautiful thing about offering clear aligners in your practice is that it can increase your measures of success, your absolute results for the happiness and health of your patients, your team, and your overall practice. And it gets to be really, really fun. And so I want you to know and understand truly if you are just getting started with clear aligners, I'm so glad you're here because I want you to really fully understand the opportunities for it to change your practice, to change your team, to change your patient's experience. And this gets to be something that's fun to implement in your practice. It will change your culture. Systemizing this procedure is critical, not only for the profitability, but for the growth. Plan to grow, plan to do things in a really high level way. And systems are going to help you do that, but also take it off your shoulders and give it to your team in a really, really organized way. Keep your financial presentation simple. 3 options, no more. Use social media to grow the awareness. Let your patients know that you offer it. And then delegate this momentum to your team. Clarify their roles, make it clear how they win, and you all win together. And so implementing these systems is not just going to increase your production because I got to see that in my practice. I loved seeing our numbers go up. I felt like a hero as an office manager, as a treatment coordinator, but it's more than that. It will change the culture. It can reduce the stress and increase the joy in your practice just from one procedure. And it will ultimately help you take better care of your patients. It will help be a preventative dentist rather than a reactive dentist. It will help you look at the entire mouth rather than just one tooth at a time. And our patients deserve that. They want it and are ready for it in today's market. So now is the time. So I'm going to open it up to any questions that you guys might have. I also see that we have a question about any advice about the cost range presentation. So there are a lot of people that will say just have one price across the board. Just don't change the price, just have one price. Or I see some practices that will have like a light price. So if it's just like a little bit of lower anterior crowding, we're not moving the bite, we're not, doing anything super invasive, it's going to be like 10 aligners or less. They will have a different price point because often, depending on the clear aligner system that you're using, Invisalign will have a lower lab fee for less aligners. But if you want to keep it super simple, then having one price point allows it just to be straight up across the board. But often practices will have, if it's more complex case, it will go up in range. And the cost itself, I've seen the cost for clear aligners be anywhere from $2,500 for the whole case to 10,000. So it very much depends on your location. I like to do a cost analysis of my clear aligner cases just to see like what is it actually costing us to provide this for our patients? How do we make it more efficient? And really get clear on what is a smart price for you to offer your patients that you're not losing money on your clear aligner cases, but you're also competitive within your marketplace. So it's a little bit of trying to figure that out, what is going to be best for your location, your demographic, what are other people charging in your area? Finding out these questions is really helpful.